that psychotic disorders are taking over our fellow citizens? Well, now you know!
There are over 2.2 million people suffering from a psychotic disorder. There are different kinds of psychotic disorders. There's the schizophrenia disorder, the schizoaffective disorder, the schizophreniform disorder, and delusional disorder. And there's more.
Who are affected by psychotic disorders? Well, psychotic disorders affects anyone and everyone. Wait, no, not everyone, but it does affect anyone.
However, you are more likely to get affected with psychotic disorder if you have a brain tumor or if you abuse drugs.
What causes psychotic disorders?
Well, the exact cause of psychotic disorders is not known, but researchers believe that many factors may play a role. Some psychotic disorders tend to run in families, suggesting that the tendency or likelihood to develop the disorder may be inherited. Environmental factors may also play a role in their development, including stress, drug abuse, and major life changes. People with certain psychotic disorders may have an imbalance of certain chemicals in the brain. They may be either very sensitive or produce too much of a chemical called dopamine. Dopamine is a neurotransmitter, a substance that helps nerve cells in the brain send messages to each other. An imbalance of dopamine affects the way the brain reacts to certain stimuli, such as sounds, smells, and sights, and that can lead to hallucinations and delusions.
Want to prevent psychotic disorders? Well, there is no specific known way to prevent them, but many of the related symptoms can be prevented with early detection and treatment. Seeking help as soon as symptoms appear can help decrease the disruption to the person's life, family, and friendships. Avoiding drugs and alcohol can help prevent psychotic disorders.
Here are some ways to find out if you're getting affected by a psychotic disorder.
Or in other words, going psycho!
Having hallucinations. What are hallucinations? Well, hallucinations are unusual sensory experiences of perceptions of things that aren't actually present, such as seeing things that aren't there, hearing voices, smelling odors, having a funny taste in your mouth, and feeling sensations on your skin even though nothing is touching your body.
Delusions. False beliefs that are persistent and organized and that do not go away after receiving logical or accurate information.
Some other symptoms would be disorganized speech,
confused thinking,
slow and unusual movements,
loss of interest in activities, personal hygiene, and etc.
Problems with school, work, relationships, and mood swings. Are you looking for some treatments? Well, treatments, it depends on the cause or the diagnosis.
The first line treatment for many psychotic disorders is antipsychotic medication, oral or intramuscular injection, and sometimes hospitalization is needed.
There is growing evidence that cognitive behavior therapy and family therapy can be effective in managing psychotic symptoms. When other treatments for psychosis are ineffective, electroconvulsive therapy, also known as ECT or shock treatment, is sometimes applied to relieve the underlying symptoms of psychosis due to depression.
There are support groups to help psychotic disorders.
One support group would be the Love and Support Group, because they would help you when you have a psychotic disorder. You could just go in there with a parent or with anyone you want, and they will help you. They'll provide love and support for you. But other treatments would be the mental health specialist, medications therapy, love and support.